We're going to talk about the consultation room. In the previous presentation, we talked about what case acceptance at a higher percentage can do for your practice. And the consultation room is one of the places you can affect a serious change for your business. So every once in a while, I'm watching documentaries and listening to podcasts, trying to kind of stay out of dental to some degree. And nonetheless, I watch something and I'm like, oh yeah, this is applicable to dentistry. So there's this land in Europe where this family's been tilling the soil for hundreds of years, and they've just, gone maybe 2-3 feet deep, been farmers on the land, and they had to go 6 to 8 feet deep for this mask. It's one of the biggest archaeological finds in this area, worth tens of millions of dollars. And so, for hundreds of years, they've only looked at a certain depth. But nonetheless, if you just look a little bit deeper, you take a little bit more time, you resonate with the patient, you understand their story, instead of talking to them for 5 minutes, you talk to them for half an hour, and then what's beneath the surface of their story is like vulnerability, it's shame sometimes that they allow themselves to get into this condition. And so if you take the time to speak to your patients on this level, your case acceptance will go through the roof, but what you need to really practice on is being present for these moments. And so a lot of patients, they resonate with this one. They're like, if you have a big heart when you feel bad doing what's best for you. And a lot of patients come in and they're like, hey, I've taken care of my kids for years, now it's my turn to take care of myself. Versions of that, and now I'm a father and I would absolutely do the same thing. But I think it's important for us to tell the moms and dads out there that if you continue on this same path and you keep putting everyone before you, well, this $10,000 case is going to be $50,000. So it's wise for us to educate the patients ahead of time. And just know that everyone's journey is unique to them, but when we get into the consultation room, sometimes it's the same story over and over again. Like, we've heard this 10 times over, and so it's hard to dial in and just say, hey, you know what, I'm going to be 100% present in this moment. But if you can look at each person like this is a unique story and go in there and just be curious about it, sometimes it makes the consultations a little bit more enjoyable. So deeper connections will uncover valuable insights. Of course, if they're going to do a root canal buildup and crown for $4,000 versus a $25,000 case, trust is the currency here. People will sign up for these bigger cases because they trust you. And then just know what mask your patients are wearing. So this one is from Paul Homley. I've listened, granted, they're not CDs anymore, but I had his book and all his stuff on CD, and I'd have a long commute, and I just listened to him over and over and over again. I've listened to his lectures, probably 10 or 15 times, and sometimes I'm in the consultation room and I can hear him in my head. And I did the same thing with the Carl Misch surgical stuff. I listened to his surgical stuff over and again. So I'm in a complication, I can hear Carl in my head talking about how to handle this bleed. So Paul said, I don't care when they do the case, but when they're ready, I just care that they do it with me. So a philosophy you can embody is, let's present the 10/10 veneer case, but also let's tell the patients, if you do anything at all, I want you to do this one tooth and sign up for hygiene. Let's put out the fire. This is the stuff we needed to do yesterday. So I'm always getting them to say yes, or at least at a higher majority saying yes to something, because then sometimes they're ready for the case 3 and 5 years later. I'm doing full arches on cases I presented 5 years ago, because sometimes they're going to be ready later down the road. And if they stay in my hygiene program and my doctors take care of them, then when they're ready for this more comprehensive work, they're doing it with me. And then these are the cases we get to do on a regular basis. And this is the stuff that lights me up. It's just transformative, it's fun to do, it's exciting, and it all starts somewhere. And I started with wisdom teeth, then single implants, then so on and so forth to just get up to the next level. Now, I'll never stand behind the podium and say don't refer to your specialists. Always have good relationships with your specialists. Just don't send them the crazy patients. Now, at the same time, send them all the crazy patients, but send them some good ones too, so they don't have that negative association with your referral coming into their practice. And then, when to refer, it's like, okay, well, what do I know to refer, and when am I sure, and when am I not sure? Talk to your mentors. Send them the case, send them the x-rays, and then if it's me, I'll weigh in and I'll say, hey, for these reasons, I think you could send this one to your specialist. And we talked about this before. Go to their office, get the knowledge. Just don't send the case away for free. If you send the case away and you kind of want to do it or see it, then ask them if you can be present in the operatory with them. And a lot of them are going to say yes. A lot of the periodontists and oral surgeons will say yes, and some of them, of course, will say no. So from a marketing perspective, how do we approach things? So there's fast fuel and there's slow fuel. There's things you can do that will immediately yield a result in your business, and then there's things you can do that will yield a result over 2 to 5 years. And you got to play both games. You got to have the vision for the future, as well as how do I affect a change right now. So Google paid ads, super expensive. To market for implants and full arch, super expensive. So I'm not recommending anyone do that. What I am recommending is maybe you want to market towards dentures. The keywords and the AdWords on dentures are very, very cheap. And guess what? Those patients are coming in, and now you can educate them about implants. So you get the exodontia done. You get the bone grafting done. Maybe they are in a denture. And then what you can consider doing, and this is something I wish I did from the get-go, is create an Excel sheet, the patient's email, their cell phone number, the procedure type, and then rank the difficulty level. Then what you can do with the Excel sheet is you can say, okay, this is all the patients that need single implants, this is all the patients that need vertical sinus lifts, this is all the patients that need laterals, here's all the patients that need zygomas, full arch, pterygoids, whatever you decide, and then you run a marketing campaign to those specific patients saying, hey, we're going to accept 10 patients at a reduced fee. And you're not saying I'm doing this at a reduced fee because I don't really have repetitions and I don't know what I'm doing. You're going to tell the patients, hey, we're going to do this at a reduced fee if you sign this marketing waiver that allows us to do 10 videos. And so we sign up for these longitudinal videos where we get pre-surgical videos, then we get the reveal videos, then we get a 2-week video. And what I've found is if you do something that's enough transformation for the patients, maybe it's a veneer case, maybe there's just some anterior crowns, anything that it is, orthodontics with a good before and after, then you get this 2-week later video. They have the endorphins, the dopamine, the serotonin still flowing through them. If you wait 9 months when they're in their final zirconias, sometimes that enthusiasm, that look in their eye has subdued a little bit. So you need to get videos at different increments. So make sure your marketing team has what they need, and then you take those videos and you put it on social media, and you can get really, strategic with it. You can say, okay, well, guess what? Delta Dental works at JBS right down the street. I'm going to geo-fence this ad campaign to this one area. So you're selectively spending money around certain organizations where there's a hyper concentration of patients who might need that procedure. So you can get really into it and save a lot of money by not hiring a bunch of third-party companies to do this for you. You can just have a marketing company that you've given direction to really amplify your program. So then your social media ads can lead to microsites and landing pages, and you can set up surveys for the patients. So now you're pre-qualifying and pre-selecting the patients online before they ever come into your practice. And then when you've done your math like we talked about before, and there's enough revenue in your business, then you can outsource the entire marketing program to a third-party company, and they charge you an arm and a leg, but now you're saving on payroll hours for a team member who was doing this in the past. And then we have our marketing slow fuel. And so the slow fuel is going to be talking to your current patients, okay? In my pocket at all times are 2 care to share cards. Care to share card for the general practice. You send someone you care about to someone you trust. That's just, I think I got that from Steve Rasner. Send someone you care about to someone you trust. And then it's a $50 card. So $50 for the patient, and then $50 for the friend who comes in and they just get it off their balance. TV commercials, and the other card I have is a $500 referral card for full arch. Or if you do a lot of veneer cases, $500. Because at the end of the day, these $20,000, $50,000 cases, the ad spend you have to acquire that patient, and you'll do your own math, is usually in that range. So would I rather just have a friend send me a family member versus paying a marketing company? All day long. So what I'll do is I'll write my cell phone number on the card, and we've A and B tested this where you can write your cell phone number on it, or you can have it pre-printed on the card. And I go with write your number on it, because at the end of the day, it shows personalization and customization. And then when I had my LASIK done, I knew the ophthalmologist who did my LASIK, and billion-dollar organization, huge industry. He's like, hey, we pay millions of dollars for consulting every year. And when he was done, he just sat in his chair, he crossed his legs, he pulled out a business card, he wrote his cell phone number on it, he handed it to me. And then I stopped him. I was like, hey, man, that was really slick. Like, you got your systems dialed in. Where did you learn this from? And he's like, hey, we spent millions on consulting to get our business dialed in this way. And these are the things we can do in just a very simplistic way. It's something we can just do every single time, and it's free. Then you can get into TV commercials. And what you would typically see with TV commercials is you see an influx of calls, a superfluous amount of calls that will come in right off the bat. And then all of a sudden, it all drops off and dies out. And then for me, I was like, man, I'm burning loads of cash right now, and I'm not getting an ROI. And I just was like, okay, stay the course. Test the theory. I'm just an experimenter who happens to be a dentist. Let's test this out. Let's see what happens. And then it picks back up. And then what I found was I was asking patients, well, how did you hear about us in the consultation room? And they're like, oh, I saw your commercial 5 or 10 times, and then I finally called. So it's like, okay, you have to stay with a program, and you have to believe in the program, and you have to double down on it. And sometimes there's down periods, and sometimes there's up periods. But if you beat on that drum long enough, for a long enough period of time, people in the community will know that you're the expert on this, or at least they'll perceive that you're the expert on it because TV carries some authority with it. Internal referral program we talked about, patient testimonial videos. I think it's nice to have low budget and then high budget ones, and then the longitudinal videos that we talked about. Print marketing is completely up to you. Know your geographic area. I wasted a lot of money on print. I stuck with it for 2 years. It didn't really have an ROI in my area, but I know in certain places print marketing works really, really well. So just kind of beta test things and track your numbers. And the cool thing about print marketing is now you can have a hybrid of print marketing and digital, because you can put QR codes on everything post-COVID. So on your print marketing campaign, you can buy that stuff in bulk, put a QR code on it, have it linked to all these educational videos, and then you can just change the videos over time. So all your print marketing is pre-bought at a very low, cost per acquisition per mailer, and then you can still update all your content on it later down the road. And then educational content in your office. We have TVs in the reception area. We have slideshows of the team, so we introduce all the team members. We talk about the procedures we do, and then I have my commercial up in my reception area. And in the beginning, I was like, okay, this is egotistical. It made me feel uncomfortable to see my face on my own TVs in my own office, but at the same time, there's patients who come in for the general practice. They see you talking about airway or implants. They don't know that you offer that because they're just there for a filling. And then they come back into the operatory and they talk about oh, by the way, my husband might need this, or so-and-so would be interested. And then you hand them the card and you say, hey, if you have any friends or family who are looking for a dentist, we're a growing practice, we'd really appreciate it. Some version of that. You can just say anything to ask for the referral, but you have to ask for the referral every time, or patients will assume that you don't want one. And times are changing, and especially with marketing and advertising and how much these companies are charging, quite frankly, I just think it's highway robbery sometimes. So what I'd love to encourage everyone to do is figure out the ways to get into the game in a strategic manner, then build up revenue, and then start spending extra money on these marketing campaigns and testing different theories out. So case acceptance needs to change. And again, increasing your case acceptance by 5% can have a massive impact. And don't be afraid to try new things. A mistake that makes you humble is better than an achievement that makes you arrogant. And in my younger years, I was full of a lot of achievements that made me very, very arrogant, and then I was served a lot of humble pie along the way. And I think children are a good teacher too. And children will kind of reflect back to you the way you show up in the world. So try new things, take risks, try a new technique in the consultation room, right? Maybe not on your big $50,000 case, but if it's a $5,000 case, yeah, try something new, try someone's verbiage. I'm gonna give you different verbiage here to use, but if it's not authentic and genuine to you, don't use it, right? Figure out what really resonates for you, because your patients will know when it's canned material, and then they're gonna know when it's you speaking. And then my children taught me that two things can be true. They taught me that I can be right and I could still lose the argument. And in our businesses, you can be more profitable and provide exceptional clinical results all at the same time. So larger treatment is what we're aiming at. We want to increase your productivity per hour. How do we do that? IV sedation is great. Hey, I don't want to sedate you 4 times to take care of all 4 quadrants. I don't think that's like a healthy thing to do. If we're going to do a sedation, let's take care of as much as we can to get as much done as possible, because you're going to be here and be sedated and you got to take time off work. So just saying a version of that. For whatever reason, patience and sedation, they equate it to, okay, yeah, it makes sense not to break this up. And then also, once they're taking sedatives, it allows very busy people who don't want to ask people for help, it allows them to take their responsibility hat off and go home and just be tired for the day. And someone else is there helping with all the things that are in their life. And so if we look at practice revenue and EBITDA, absolutely 100% we have to look at that. A healthy business and a healthy business owner with a thriving practice can take care of everyone in their building and take care of all the patients in the community. So we want you to be profitable, but also let's focus on the emotional EBITDA for the patients as well. Because they're not signing up and saying, hey, I want to pay you 50 grand for teeth. They're saying, I'm going to pay you 50 grand for confidence or for self-esteem or what have you, but let's just hear it from them.
The loneliness, man, of not being able to smile and talk to people and just being isolated, and people won't look you in the eye and they avoid you, and you know, and you can't get a job because no one wants to hire someone that looks like that, and so it's just really isolating.
I said, this is for me. It's time for me to take care of me, take care of my kids. I am making this the best investment I will ever make.
I actually lost the top and bottom within the last year and a half, and boy, I tell you, it just hit me. I mean, I just sunk. That was the start of my really getting serious, really wanting to take care of myself. It was about, 7, 8 years ago when I really dove in to wanting my self-care to be priority number 1.
I'm very humble. And this is the beginning of getting rid of the final visual reminder I have every day of the abuse I went through for almost 13 years.
I don't know, I can't wait to just get out there again. I can't wait to not have to wear a mask or hide.
I think that's another part for me. It was just finally realizing that this wasn't my fault. I feel like there's a lot of shame when people don't have perfect teeth. And that was the biggest thing for me, overcoming that hurdle of this wasn't my fault and I deserve to be happy and I deserve this.
So nobody here talked about money. It was, I deserve this. I'm ashamed. I'm doing this for myself. So there's a lot of emotion and vulnerability built up in there. And then one thing I also forgot to mention is there's a lot of patients who are kind of embarrassed about doing a video on the practice, and Sheena here did a Zoom call. So if you give them the option to do the testimonial video via a Zoom call and record it, that can also be really powerful, and you'll get more marketing videos done that way because more patients will feel comfortable. So let's get into the strategic component. Like, here's the checklist. What do we actually do? So before they ever come into the practice, you have videos made. They sign up for implants. Boom, they get the video. Hey, you signed up for you signed up for implants in our practice. Here's a what to expect video. Here's the doctor you're gonna meet. If they sign up for ortho or sleep, same thing. Just create these videos. They can be low budget at first and then get a professional crew to come out at some point in the future. And then if they say yes to treatment, they get entered into a whole different cache of videos. And if they say no to treatment, then they get a whole different bunch of videos that go out to say, hey, here's a testimonial. Here's something you were interested in. Let's keep the touch point going with these patients. And then you have to have treatment coordinators that actually protect your time. So if you're doing free consultations for implants, and I highly encourage that, but you got to protect your time, have someone who's trained on the phones who's going to grade the call. And we grade it red, yellow, and green. The reds are like, hey, this was a horrible phone call, but they still want to show up. We give them 30 minutes. If we're too busy to see them that day, they get photography, CBCT, medical history. Thanks for coming in. The doctor's going to review it. Let's schedule your second consultation. And typically the show rate on the second consultation is great because they've already come to the practice. Now, if time does permit that day, then of course go through the whole consultation with them. A yellow means like, hey, I don't know. They said some right things, they said some wrong things, let's kind of see. We give them an hour. And then they have a high credit, you can check their credit on Cherry or iSoft credit pull, it's a soft credit inquiry. With those, it's if they tell you there's bad credit, it doesn't always mean they have bad credit. But if they tell you it's good credit, it always means they have good credit. So there's ways to pre-screen your patients ahead of time as well. So we give them 90 minutes for a good potential consultation so they can meet the doctor and go through the entire program and potentially go through financing and lock the case in that same day. And then we encourage them to bring a spouse. And some verbiage is not like, hey, we know you can't make this decision on your own, so bring your spouse in here to help. It's, this is going to be a big decision, and we recommend bringing in someone who can help understand the process and support you after the surgery. But it's really a beautiful moment when the patient is like, no, we can't do this. And then the husband or wife says, no, you do need this. We have been struggling with this for a long time. We'll figure out a way to get it done. So tooth-based dentistry, it's typically insurance-based. And then when you get into these bigger cases and you bring a spouse or someone else in there, sometimes the community will rally around the person to say, hey, we've seen you be like degrading over the years. We've seen you become a shell of your former self. It's time for you to reinvest this back in yourself. We'll figure out a way to make it happen. So sometimes they won't do $5,000 worth of work, but they'll figure out a way to do 30. And it's just, everything is backwards. It's, shocked me numerous times over. So now the patient shows up. Now what do we do? So you have a greeter. I think we all have someone who's front and center, that big bubbly personality, hopefully. So if there's a 70-year-old named Frank coming in through the door, and there's someone who's 70-year-old who walks through your doors, stand up and say, you must be Frank, not, what's your name, what's your date of birth, right? Like just greet them like they're walking into your living room. Give them a tour. Unless you were in the small little sardine can practice and you don't have the space to give a tour, give them a tour. Show them the technology. And when you do a tour of the rooms, don't say, hey, here's hygiene where we probe and scale your teeth. Say, hey, this is Adriana's room. Okay, cool. This is Dr. Michael Lundy's room. This is Dr. Shivani Patel's room. So introduce them to the people in the practice through the tour at the same time. Also, touch on all our senses. So we actually have a little, it's not an easy bake oven, but you guys know what I'm trying to say, right? A little toaster oven, and we get these Otis cookies, and we bake them in the reception area. So when people walk into the office, it smells like fresh baked cookies. And then, of course, the patients get to have the cookies if they want, just not before hygiene, because the hygienist will be pissed. It's actually afterwards on the way out. And so, or you can have scent air, and you can have a Weston smell in the HVAC, so your office smells, I know we don't use a lot of eugenol, but the office won't smell like a dental office anymore. And then when they come into the consultation room, have things pre-laminated, have paperwork there, have it seem like you do this all the time. Have paperwork on nutrition and supplementation and foods to eat afterwards and post-op care and QR codes with QR codes to QR codes about different videos that they can use to have all the information they need after the procedure. If you can tell someone their experience in 6 months from after coming into your practice, you are supremely qualified to take care of them. So having all this print material pre-made for your patients gives them that sense that you're the person who can take care of them because you do this every single day, even if you don't do it every single day yet. And then instruction, home care, all the stuff, and then a box of models. So again, we have the smell taken care of. Now I want to hand them a model, and I want them to hold zirconia, and I want to hold a resin, and I want them to hold the denture. And then I take the zirconia models and I clank them together and I say, okay, when you get your final set of teeth, you might hear this resonance. Because when they get their final set of teeth and they clink their teeth together, they're going to say, hey, doc, my teeth make a sound. But if I told them this in the consultation room 6 months before, then I don't have that problem later down the road. So it's all about kind of touching base on all these things. And then also at the same time, you should record your consultations. You can record it just with your voice memo and say, hey, it's Dr. Dhoon and Samantha, and we're talking about full arch, and just record it. You can get these AI things called Ploud, it's P-L-A-U-D, that you put on your phone. It just transcribes the entire thing, and then you have that for your records. But there's so many ways just to record the consultation, and it's twofold. Medical legal, sometimes it's reminding the patient when they forget things 6 months later that, hey, we actually did speak about this. And then, yeah, it just protects the practice. Oh, and then it lets you listen to your consultations later. So then you can figure out where maybe you had a misstep, or if they didn't accept the case, then you can like listen to your tape. It's like you're an athlete watching your video. You're watching film afterwards to figure out how you can improve. So then we get to the consultation room. So I don't sit across the table from the patient. I sit kind of in between my treatment coordinator and the patient. So we're both looking at the TV together. For whatever reason, if you sit across the table, maybe it gives a sense of an adversarial type of thing. I walk in, I shake their hand. It's the thing that's old as time. Hey, I don't have a weapon. I come in peace. Let's break bread. And then we shake hands, and then we exchange oxytocin. And there's something about a deal getting done before we even have the conversation. And then we showcase the technology, put the CBCT up on the screen. We go through everything. I plan the case in front of them. And then have a bunch of before and after pictures. And if you don't have a lot of before and after pictures, this next comment is like, if you only feel comfortable with it, do it. If you don't do it. But you can borrow some before and after pictures from a friend and then utilize those. If you feel comfortable with it, don't say, hey, here's a case I did. Just say, hey, here's a transformation for a case that's just like yours. And then you can show them that. Or when you actually get your own photography, take 20 pictures on one patient. So even if you only have 5 reconstructions done, well, it looks like you have 100 pictures in the folder, and you just scroll up and down in the folder and show them that you've done this 1,000,000 times when you've only done it 5 times, and then you can lock in the case. And then when you get a superfluous amount of cases under your belt, and you have a Hispanic male who's 50 coming in with a missing front tooth, you look for the Hispanic male who you did their case last week, who's missing a front tooth, and you show them someone who's like them. So you don't show the 80-year-old, the 30-year-old reconstruction, you show the 30-year-old, the 30-year-old, and the 80-year-old, the 80-year-old. Show people that you've done cases like theirs specifically. The layout of the room just needs to be really intentional. It needs to be simplistic and clean. Have a box of models, show them the before and after pictures, information with the FAQs, and then we already talked about the referral cards. And then with your box of models, just don't throw all the models on the table. This box you can buy for like $20 on Etsy. I'm sure you can find it on Amazon these days. But we have models for everything, and it's interactive. I'm handing them things. I'm saying, hey, do you feel that weight difference? Okay, you feel the temporaries? You know, I'm making sure they're part of the conversation. I'm including them with all of it. And then we just need to go into active listening. I don't like taking notes while they're listening, so you can rely on technology or have your treatment coordinator write things down. But if you're actively listening, you shouldn't be writing anything down. And then some psychological stuff of mirroring their energy. If they're a fast talker, speed it up. If they're a slow talker, slow it down. If they lean in, lean in. If they lean back, lean back. Don't make it overtly obvious, but just kind of play with that in the consultation rooms, and you might be surprised that you connect with people more when you show up like they're showing up versus having them kind of have to get in line with what you're doing in your practice. And then edify your team when possible. Humble brag. This part was really hard for me in the beginning because I was so afraid of being perceived as egotistical that I probably undersold myself and didn't close enough cases. People want to know you're good at what you do, right? You don't have to be cocky about it, but there's a difference between being cocky and just being confident. So resonate with that confidence and just say, hey, we're really good at what we do. We do this all day long. If you choose to get the work done here, we're going to take really good care of you. Very simple things can be said, or you can kind of sneak in, hey, I'm experienced. Well, how do I say I'm experienced? Hey, when I was doing this 12 years ago, we were doing it this way. It's actually really good that you're here today because it's even better than it's been. So I told them I'm experienced without having to tell them I'm experienced. And I told them it's good that they waited because people have shame by waiting. I said, hey, it's a good thing you waited. There's new technology that's out that's actually going to make this easier for all of us. So you just need to figure out a way to have conversational chemistry with your patients. So how do we do that? Let them start. Let them lead. Sometimes you need to prompt them to do it, but if you allow them to lead, they'll tell you some things that they might not tell you if you started off the conversation. So you let them start. Now, your treatment coordinator is going to tell you if they're a talker. If they're a talker, you got to kind of keep them in lines because you got to be in other places too. But if they're just a general person within the standard deviation of normal human beings, then yeah, let them start and have that conversation. It's likely it's the first time they're sharing this vulnerability. It's hard for people to open up and say, hey, I'm ashamed of what I've done to myself over these past years. I have no clue how this happened. And oftentimes what they'll say is, you know, it happened really slow at first, and then all of a sudden it was faster than I could have ever imagined, and now I'm here, and I need help. And so you need to be able to dial into that and forget about the 3 other hygiene rooms you have waiting so you can have that conversation and dial in with the patient and get the case closed. Because if they're in the right place and you're good at what you do, then they should do the case with you because you're the right person to take care of it for them. And listen till they're done talking or redirect the talkers into the right place. Never tell anyone that their experience or feelings are wrong. If they say something that's factually incorrect and they say, hey, the baby stole my calcium, don't correct them. Let them think the baby stole their calcium. Nothing good comes from you trying to negotiate that comment. So at the same time, you don't have to agree with it. You know, don't give up your own autonomy. You just say, hey, that's really interesting, and just keep moving forward. So one-liners to consider. If they have a lot of walls up and they're not starting, you can even flat out say, hey, this is a judgment-free zone. Or you can say, I have conversations like this every single day, and I want you to know that everything you're telling me is helping me put together the best possible plan for you. So what am I telling them here? I do this every single day. I talk to 8 patients like you per day, and I've been doing this for 13 years. You're not alone. Because a lot of people are isolated and they think that their degradation is their fault and they feel like they're on an island by themselves. And it's like, no, you're not alone in this. We just don't see those patients out there all the time because they're not smiling because we confuse them as unhappy people. They're just embarrassed to go out in public. But I have these conversations all the time and I'm here for you and you're in the right place. And then once they're done actually telling you what's on their mind, thank them for sharing. Sometimes it's hard for people to open up. You can just say, hey, I really appreciate you sharing that with me. Or thank you for telling me that. They need to hear that. They need to hear that when they're being vulnerable. So now you have the story. Now what do? Now we go into dental mode. We're done being psychiatrist and the listener, and now we're into dental mode. And so you have to talk about the disease like it's just a matter of fact. Like the sun rises and the sun sets every single day. This is what's happening in your body. This is the disease. This is how we fix it. And then be confident in the way that you deliver the message. If they have 17 options, don't tell them 17 options. Tell them the 3 best options. And then the 4th option is put out the fire. If you were to do anything today, and if you were to sign up for anything at all, it's this one thing that's going to make you healthier. And you should at least consider that because we needed to do that one yesterday. And I say that all the time. This is my put out the fire option for you. Just do this one thing, we'll build the trust, and we'll take care of you later. And then you can mirror their communication style. So I like to draw on the panos if you have that option. The Vatex software lets you. I'm not familiar with every CBCT software, but I physically will draw on it. It shows a customization. I show them before and after pictures, and then I explain the dental complexities in a meaningful way. So if they're a time-based person and more people than ever are very just strapped for time, I tell them, hey, you're going to see me 10 times over 8 months. And if I can say that with confidence, that's like, okay, this guy does this so much, he knows exactly how long it's going to take, and he knows exactly how many appointments it's going to take. And then you can put a disclaimer in there, hey, as long as we don't have any complications. Because if it ends up being 20 times, then you seem like you don't know what you're saying either. But show them that the time commitment that they're going to be giving to you is finite, and it's not going to, endure and mess up their busy schedules. And if they're fearful, you can talk about anesthesia, you can talk about the technological advances we have, you can tell them like, hey, we can keep you more comfortable than we've ever been able to with all this new stuff we have, so it's a good thing you waited. And we take care of patients who have anxiety every single day. And then if they're worried about money, and most people bring up money at some point, I just tell them like, look, if we just do the upper left, by the time we get the upper left done, the upper right might be more expensive. And if the upper right's not more expensive, well then 2 years later when your insurance is ready for the lower left, that's for sure gonna be more expensive. And then 3 years later when we get to the lower right, it's game over at that point. It's like painting the Golden Gate Bridge. By the time they're done painting the bridge, they physically have to start painting it again because it takes so long to finish. And I actually use that example with the patients to say, hey, this is not an insurance-based conversation. Now, I will 100% do anything you want to do. You're driving the car, I'm navigating it, but I would be remiss if I didn't tell you that I think that this is a mistake. And I'll just wave the red flag when I think we're making a mistake here, but at the same time, you can do anything you want to do. And I always tell the patients, they are in 100% complete control of the situation, but it's my job to make sure they understand, at least from my vantage point, that danger is ahead. So we're clear about the pros and cons, number of visits, and talk about this stuff like it's all you do, right? Talk about their experience at 2 weeks. Talk about their experience at 6 months. Talk about their experience in 3 years. Hey, in 3 years, when you start smiling more, the muscles in your face are gonna pull up even more. You might show that prosthetic transition line. So just know if that happens, we would have another procedure, and we can get you an estimate for it if you wanna know, or you might have to always get Botox. So you're addressing the future concerns, because if I've done this enough, I know what the future holds for this patient, and I'm recording that conversation, so when they show the transition line in 3 or 5 years, and they don't want to pay for another surgery, I can just pull up that automated AI report and just tell them what we talked about. And so we have complex dental concepts that we want to talk about as well. So you have to talk about the expectations. If the case is hard, tell them it's hard, right? Say you're in the right place, your case is hard, but you're in the right place. Because what's going to happen if you tell them the case is easy and you're like, oh yeah, I can take care of this every single time, and then they have a complication, they think something that you did was wrong. But if I tell them, hey, I take care of hard cases all the time and you're a hard case, and then we have a complication, they're way more understanding about that. So good communication means minor complications. I just tell the patients, hey, the patients I get the best results with are the people who stay in contact with me. And if they're old school tough, or they seem like someone who just don't want to bother me, I give them the invitation. I say, if you sit on something for 2 weeks and you say, hey, I'm just going to see the doctor in 2 weeks, I'll just talk about it then. This could be a major issue. It could be very expensive, and it could take 2 years to fix. So what am I saying? I'm saying call me, or I'm going to charge you more if I have to fix it, and it's going to take a really long time. But I'm not outright saying that. I'm telling them that subtly. And then if we're having a good vibe, I don't want them to think that just because they have money that I'm going to do their case. That's like that used car salesman thing. You go on the lot and you can just feel it from the parking lot before you even get to the building. So I tell them they need to qualify in my practice to do this. So I say, can I rely on you to make all your appointments, your hygiene appointments and doctor appointments, if we get this thing started? If you can't, we shouldn't do the case. When you have time in your life to do this, then tell me and we'll get started. And then I also tell them, take your responsibility hat off. I like telling that in front of their spouse, because sometimes people have a hard time saying, hey, I just had a surgery, but now I need 2 weeks off. So I need you to take your responsibility hat off for a little bit and rest and recover. And people appreciate me saying that to them because they need to hear it, and their spouses need to hear that sometimes too. And then we get into our complex finance and cost and financing. There's different words and things you can use to kind of navigate around this. But essentially, we like to handwrite the treatment plans, so it has more customization to it versus printing everything out. And then if this is an insurance-based question and it's a $10,000 treatment plan, I say, your cash fee is $10,000. Your insurance company pays $1,500. They give you an additional discount, which is the write-off or adjustment of $2,500. So out of the $10,000, your portion is $6,000. They accept treatment way more. And then I'll also say, you have a really good plan. That's actually a really good plan. And I look at Amanda and she nods her head. She's like, yeah, that's a really good plan. Because if you tell someone, hey, this is $6,000, they're going to say, well, what about my insurance? But if I start at the top and I work them down to the bottom, I'm like, look at all the stuff your insurance did. I don't have insurance questions anymore. I've already told them. I've already addressed those things with them. If we're talking about bundled versus unbundled, I talked about that in the other presentation, about equating it to the medical industry. If they start asking about financing, I have overtly ruined my consultation by talking about money. So you can bring it up and you should talk about it, but then at that point, you're not qualified to lock in a case and talk about all the intricacies of financing, because you could accidentally insult someone's dignity about their ability to pay for something and you'll lose the case, and I've done that before. So what I tell the patients is, hey, we work with a lot of companies that can break this out over 5 to 9 years. Amanda is great at fitting this not within your budget, fitting this within your life, and she's really, really good at what she does. Now, do you have any clinical questions for me? If they ask another financing question, I just point at the x-ray and I say, I speak this language fluently. I'm unqualified to walk you through the next stuff. Amanda's really great for this. Do you have any clinical questions for me? If not, I'll leave you in good hands, and I got to go do a round. And so then I get out of there. So I talk about the numbers, I let them know that there's options, I don't go into the details, and then I just get out. So traditionally speaking, Proceed Finance, Compassionate Finance, Cherry, there's so many companies out there. Just kind of figure out what works for you. You can do 5% off for a cashier's check. You can ask for greenbacks if you like, and you have a safe in the practice. You have mounted to a 2x4. If you feel comfortable with that much cash in the practice, I don't anymore, so I just do a cashier's check for 5% off. And then there's creative options that people can talk about as well, where you can have family members that will come in and help you with a $50,000 case, where a family member won't give you $2,000 for a single tooth. We've had crowdsourcing, where we've had this kid named Alex come in, and the whole community, he got out of prison, he turned his life around. He's just a young kid who got locked up, and he turned his life around, and the church and everyone in the community got behind him, and they did a crowdfunding page for him. People can refinance when interest rates come down, so when interest rates come down, get your verbiage ready for cash out refis. And then 401ks and saving plans, we'll kind of see what happens in the market, but people always rely on their 401ks and stuff, and they're willing to do it when it's something that they deserve to have for themselves. It's not teeth, they're paying for self-esteem. So now we go into the medical history, and again, I'm qualifying the patient. I'm telling them your health means more to me than your money. So I'll say, and I talk about the money, and then I don't want that noodling around in their brain and not listening to anything else, so then I start talking about medical history. I pull them out of the financial conversation, and I start talking about medical history. So I have a few medical questions to ask you to see if you qualify for the procedure. Because if they're not healthy enough, I'm not taking a dime from them. That's what I'm trying to tell them by saying that. And then of course, I want an accurate medical history at the same time. I'll also say I'll never change another doctor's medications, so don't stop taking anything that is prescribed to you. And in the same vein, no one can change the medications I give you. So the docs need to call me. Here's my personal cell phone number. It takes a team to take care of you. Sensitive questions are important, so hey, I have to ask everyone this. So I preface it with, I ask everyone, not just you because you look like a drug addict. I have to ask everyone this. Do you use any recreational drugs? In Colorado, a lot of cannabis use, so you got to talk about that. Wisdom teeth, you got to ask the young females, like, hey, is there any chance you could be pregnant? Sometimes if the parents are in the room, it's a little awkward, but you just got to ask. And then sometimes if the patient's a 55-year-old female, you still got to ask the question, and they give you the, oh, honey, that thing is gone type of comment. But at the same time, ask the questions to protect the patients. And then antidepressants. Some people are embarrassed about their antidepressant use, and there's nothing to be embarrassed about. So I'll tell them, I have a lot of patients that have worked really hard to get their dosages right. I just need to know if you have any antidepressants or any SSRIs that you're taking. So I preface it with a lot of people have this happening to them, and I need to know your medical history as well. And then smoking, I just say, like, look, we live in the real world, but I need to rely on you to quit for a week before the surgery and for 3 months after, and if you can't do that, we're not going to do the procedure. And then if they give me the whole, yeah, doc, I can do it, I just remind them, just know when you smoke that cigarette, that's a $50,000 cigarette you're smoking. So what am I telling them? I'm 100% charging you if there's a failure, 100%. And I'm not telling them I'm charging you if you smoke and you break because you're addicted to a substance that's super addictive, and if you have a lapse in judgment for one moment and you fail at it, I'm gonna stick it to you and charge you 50 grand. I'm just saying, hey, that's a $50,000 cigarette. Just think about that before you light up. Because patients need to know that too. They need to know that they have to pay for work that they've subtly compromised the integrity of. And then, do you have any clinical questions for me? I get out of the room. If you're ready, if you choose to move forward with us, because it's always their choice, all I need from you is your commitment to make all your hygiene and doctor visits. I shake everyone's hand in the room. We had a police officer with his adult special needs son in the chair, and I shook the special needs son's hand, and I just, out of my corner of my eye, saw the father, and the way he looked at me after that, just acknowledging people in the room, meant so much to him. So, little girls, give them the fist pound, whatever, just like, hey, acknowledge all the kids in the room. Everyone, just say thank you to everyone for being there. Write your cell phone number down on the card, hand it to them, and say, hey, if you have any questions, I'm right around the corner. So I'm always here, I'm just right around the corner if you need me. So when we're describing the procedure, PRF is not, hey, we're gonna spin down your blood and take this slug and stick it in there. It's, hey, we hyper-concentrate your growth factor so you can heal faster. If they ask about bone graft, I don't say it's ground up humans and animals. I say, hey, we get a smaller amount from the hospital. It's the same thing they use. We just get smaller amounts of that, and we use that. We can place fillings and we can place implants faster than we can do fillings here. So in the patient's mind, a filling is really benign. They know what that typically feels like, and if you can say, hey, we do this thing where we're drilling a hole in your skull and putting a screw in your skull, which scares them before they can actually like commit to it, and we say, hey, we do that faster than a filling, then it's bringing scary down to a level that's benign to them that they understand. And then just a couple of one-liners that I've used through the years. Is this your first consultation? You want to find out if it's their first, second, third, or fourth. It gives you a lot of information. What made you pick up the phone to give us a call? What's the reason you're looking into this now? Just really open-ended questions. I have enough gray hair to know what I'm talking about, but not enough where I'm retiring anytime soon if they talk about, their old dentist retiring mid-treatment or something. And then I'll tell the patient, this is one thing I know better than Google and ChatGPT. So please text or call me if you have any questions. Don't look stuff up, it's just gonna scare you. What questions do you have for me versus do you have any questions for me? When I adjust occlusion, I say, where does it feel high? Not does it feel high? So then they have to say, oh, it feels high right here. So it helps me really isolate it. Change your question, change your life. So if you can formulate these questions in other ways, you're gonna get more of the responses you wanna hear. And then let them know they're not alone. And then the one in bold at the bottom I got from Mike Picos, and it's just, if they say something that's just really not smart or it's way off base, you don't want to say, hey, that's the dumbest thing I've ever heard anyone say, and then this is the actual right answer. You want to tell them, hey, it's logical to think that, but it's really this way. So, hey, you said something smart, and I'm sure there was a fact-based reason you said that, but it's really this way. And what you want to do is you want to figure out a way to speak the language of patients. And so the wellness hour, I'm not saying go spend $20,000 and go on the wellness hour and get a TV commercial made, but go on YouTube and watch other people who went on the wellness hour and hear the way that they speak to patients through television. So what I've done is there's a bunch of good ones and a bunch of bad ones. Again, with a little bit of humility. Mine are up there too, so if it sucks, don't tell me. If it's good, send me a text, let me know. But these are the verbiage that Mike Picos uses, that Dan Holtzclaw uses, that I use, that other people use. So there's all these videos you can watch, and then you can understand and have your treatment coordinators watch it, how to speak to the patient. And if you want a copy of the presentation, here's a QR code, and I absolutely appreciate all of you. Thank you for your time.